Hey everyone, welcome back. So today in my video we are going to discuss about the dreadful disease that is AIDS. Okay, AIDS stands for acquired immunodeficiency syndrome. The name itself says this particular disease is acquired and it is causing the deficiency in the immune system. Okay, first of all, what do you mean by syndrome? A syndrome is group of symptoms. When we take a group of symptoms together, they form a syndrome. Suppose I'm having headache, cough, cold. All these are different various kinds of symptoms, and when all of them come together, they form a syndrome. Okay, so syndrome is a group of symptoms. Next, AIDS is not congenital. What do you mean by congenital? Congenital is something which is acquired from the birth. From the birth it is present. AIDS is not like that. Okay, it is not congenital. It is acquired during the life. Based on the lifestyle, how we walk into the society. Okay, except for some cases, mostly AIDS is not congenital. Okay. Next, the causative agent aids the disease. Diseases are caused due to various different microbes. Okay, so this particular AIDS is caused by HIV. What is HIV? What does HIV stands for? Human immunodeficiency virus. So the AIDS is caused by HIV. Name itself says here human immunodeficiency virus. The name itself says this AIDS is caused due to a virus. This particular virus is belonging to the family of retrovirus. One thing we have to be very careful here is common cold is due to rhinovirus, AIDS is due to retrovirus. Okay, this one point should be very careful. We should not get confused between the retro and the rhinovirus. Okay, so this is the member of retrovirus, and then the special feature that this particular virus is having is the envelope enclosing RNA genome. Its RNA genome is enveloped. Okay, means there is a coating around its genome. Okay, this is the special feature of AIDS. Next, modes of spreading. It's a disease, it's a communicable disease. How is it spreading? What are different ways of spreading of the disease? First one is sexual contact. Yes, sexual contact with the infected person, not everywhere. With the infected person will leads to AIDS. Next, blood transfusion. Blood transfusion in the sense the anemic patients for whom blood is they require transfusion of blood. There, with the blood, this particular AIDS or the HIV is transferring from one person to another. Here also, blood transfusion from an infected person to a normal person will cause AIDS. And then infected needles and syringes, the injections what we call in common language, even with those which are used for infected person are again used for the normal person, then there is chance of transferring of the HIV or AIDS. Next, from HIV mother to child, maybe through placenta or through breastfeeding in the sense milk production, like milking the baby. Here's the case where we can say AIDS may be congenital because from the placenta it is coming. So placenta in the sense, even in the when the child is in the womb only the AIDS is occurring. So there small chance of getting confused that maybe AIDS be a congenital disease. Okay, that's a different thing. But modes of spreading may we are even having that HIV mother can transfer AIDS from her to the baby. Okay, the mother is having HIV, and the baby whoever born to her will also have HIV. Next, coming to misconception. What do you mean by misconceptions? Like the misunderstanding. What is the misunderstanding on this disease? People think that the AIDS is spread through touching. Now if I'm touching someone, I'm having AIDS, I'm touching someone, that person will get AIDS. That's not the case. AIDS is only spread through these reasons, maybe through through touching or other activities. AIDS is not getting spread over. So people are shunned from the society if they are known they are having AIDS. So that's not the way it's done. AIDS is only spread through these four, maybe few extra reasons, but not through mere touchings. Okay, so people have to be mentally supported. Whoever are suffering with AIDS, they should not be excluded or discarded from the society. This is another point. And then one main point that is highlighted in our NCRT is it is spread through body fluids. AIDS is spread through body fluids, not through touching. Okay, how we can say it's not through touching? Because when we touch, AIDS is not passing like common cold, but through the body fluids this AIDS is able to transfer from one person to another person. And then the time lag between the infection and the appearance of symptoms vary from person to person. Means now, if a person is infected with AIDS, he is not HIV, he is not showing symptoms even after 1 year, because the infection time and the appearance of symptom times varies from person to person. Why? Based on the immune system. If his immune system is very strong, then he will show symptoms later, means after some time. If it's an old person, then he will show symptoms, on the spot, or maybe after few months. So the time lag between the infection and appearance of the symptom varies from person to person. It may take from months to years. Years may just from 5 to 10 years. Okay, so this is the brief introduction on AIDS. Okay, it's caused by HIV, and in my next video we will be discussing on the mechanism of AIDS. How is it spread in the body? That will be discussed. Okay, thank you.